In either case, it looked like supplementation with C and E was effective in reducing pain and the secondary markers for endometrial pain. This is Generation Health. Every week we bring you the latest in news, cutting-edge research, and time-tested best practices, helping you live a longer, healthier life. Sitting across from me, PharmD, Certified Strength and Conditioning Specialist, Dante DiMatteo. How are you, sir?
I'm good, Tyler. How are you?
I feel fantastic. Over at the other end of still no sign of Josiah. It's all right. We'll make it work. I'm Tyler Andrews, your host. And today, Dante, what are we talking about?
We are talking about endometrial pain and supplementation with vitamin C and vitamin E.
Interesting.
In particular, one study.
Okay. All right. First up, what's happening behind the counter? Well, we've got some big news. 6 Alzheimer's vaccines. Feels like we mention Alzheimer's drugs every couple of months, but this is the first time that we've ever gotten to mention 6 vaccines all at once. Alzheimer's, while not fully understood, is believed to result from tau and amyloid proteins that seem to be the 2 primary sources of concern with those patients. When not properly cleared from the brain, the amyloids create plaques and the tau create neuron tangles. One researcher called these the trigger and the bullet of Alzheimer's. Over the decades, researchers have explored a number of different ways to curb the disease's progression. Lots of effort was put into developing drugs that would target and break up plaques with little success and lots of complications. Now, researchers are turning toward immunotherapies. You might know that term from cancer treatment. Immunotherapies, instead of trying to target the plaques directly, they're trying to help the body's own immune system to do its job better. That's what an immunotherapy is. And that has led to 6 different immunotherapy vaccines currently in trials, 2 of which have FDA Fast Track approval. AC Immune is one of those. It received Fast Track clearance back in June of 2023 and is currently in the midst of both phase 1 and phase 2 trials with 140 different people. The vaccine aims to elicit production of anti-amyloid antibodies. Early results show that it is generally well tolerated and does produce an antibody response. The other Fast Track vaccine is called Vaccinity and has already completed phase 2 trials with results published in August of 2023. The trial was 78 weeks long, involved 46 people, and, quote, elicited a robust, rapid antibody response, unquote. It was also generally well tolerated and showed a 97% antibody response, meaning that it increased the antibody presence by almost double. That led to a slowing of cognitive decline compared to those who received placebo. With 5.8 million Americans currently diagnosed with Alzheimer's, we are praying that these vaccines actually work and work well. And in other encouraging neurological news, researchers have demonstrated just how quickly the brain can repair itself in people with alcohol use disorder. People with alcohol use disorder tend to have a thinning in their cortex. The cortex is the outer wrinkly portion of the brain, literally the part you probably think of when you think of the brain. That part is what governs, among other things, higher order functions like decision-making and impulse control. That's why it's so difficult, among other reasons, for people with alcohol use disorder to inhibit their impulses to drink. A study involving researchers at Stanford, University of California, and the Veterans Association, Veterans Administration have shown that after complete cessation from alcohol, abstinence from alcohol, the brain is able to repair itself to levels comparable to those without the disorder in just 7.3 months. Researchers said there is a faster rate of recovery in the first 4 weeks after quitting drinking, but that the regrowth continued throughout. That is fantastic news for anyone dealing with the fallout of excessive drinking. There is hope for the brain to repair itself, given apparently not that much time. That's really, really cool. What do you think? Vaccines, 6 of them. What are I mean, if I were a betting man, what's the likelihood that one of these comes to market?
Man, it's tough to say. I would say it's high.
You think so?
Yeah.
I really hope so. Because I mean, we genuinely have talked about this and talked about this and talked about this. I want there to be some sort of move in that direction. And if it's an immunotherapy where we're just boosting the body's own ability to do what it's supposed to do, that's really exciting. Hopefully should have far fewer negative side effects.
Yeah, there's all, a lot of different schools of thought around this sort of thing. But in general, really haven't been able to make much traction with dealing with the issues surrounding Alzheimer's. And so something like this, easy to maybe put some of the potential downsides kind of out of the way and thinking about this big picture.
Absolutely. If it gives you cancer in 20 years, that's not what it does. We're just speculating. If it were to do something like that, that's an easy trade-off for me, you know? All right. So let's talk about endometrial pain. Dante, what are we talking about? What happened? It's a big study, right?
There was a meta-analysis, antioxidant vitamins, supplementation, reduce endometriosis-related pelvic pain in humans, a systematic review and meta-analysis.
Amazing title, as always.
Titles are always incredibly insightful. Basically just read the title and you're good.
Yeah. So what is endometrial pain? What is endometriosis? What are we talking about here?
Yeah. So it's a very prevalent issue, unfortunately. It's a chronic inflammatory disease, and it's defined by the presence of extra uterine endometrial tissue. So essentially you have kind of the overgrowth of the tissue that's normally supposed to be there. It starts to grow, sort of in areas that it's not supposed to. And this, hyper proliferation of tissue and cells is what lends itself to, unfortunately, a lot of the side effects and life issues associated with it.
Is it just thickening? I mean, is it just like a rapid thickening of the uterine wall?
It's complicated, but in general, that's a fair, a very fair assessment, I would say.
Okay.
I mean, they call them basically endometrial lesions that are there. It's just, you have to just think of it as like this hyper proliferation of cells and tissues. And it's just such a, over the top cascade of events that leads to just what you can see on the outer surface, basically of, as just more tissue.
Got it.
More,
And this results in a great deal of pain, among other things.
Absolutely. So the main sort of issues being dysmenorrhea, so, painful periods, issues with periods, chronic pelvic pain in general, and then also issues with pain during intercourse and around that sort of thing. And then also, by default, affects personal relationships and your professional life.
Sure.
And it's just the symptoms and issues associated with it can be quite debilitating, in addition to having, playing a role in fertility and the potential to remain fertile and become pregnant, for sure, has an impact on that as well.
And this is relatively widespread.
It is. So I would say realistically, it affects up to 10% of reproductive age women, and also 35 to 50% of those who have pelvic pain and infertility.
Okay.
End up having
that ends up being the cause
as sort of the underlying issue.
Okay.
Yes.
All right. Do we know what causes this?
So there really is not one clear agreed upon source. Of course, it's a very complicated etiology. One of the papers we were looking at has essentially a listing and explanation of different theories behind it. So we can go over those briefly to kind of shed further light on how, how difficult maybe it is to treat this and why there are a handful of different approaches that worked to manage the symptoms.
Yeah.
And so one of the theories that's been around for a while is retrograde menstruation. And so essentially the flow of the endometrial content that ends up in the pelvis essentially allows for endometrial lesions to actually implant themselves. So it's just like this buildup of stuff throughout the course of menstruation.
What should have left the body didn't properly. And then that's interesting. That makes sense.
Yep. And so then there's also transformation of actual tissues that are supposed to be there. They actually just kind of change their properties, and that's, the actual cell types and that sort of thing can lend itself to the manifestation of this. Hormones, of course. So estrogen, it's referred to basically as the estrogen-driven proliferation of endometrial lesions, as you hear the endometrial lesions again.
Yep.
And then also, as we talked about in some other settings, progesterone plays a role in sort of the management of how the endometrium responds to different hormones as well. So some sort of resistance to the progesterone mediated control allows for this over proliferation of tissue.
Right.
So that's the hormonal impact. Now this is where the current research will sort of come in. The current paper we were referring to here at the outset.
Yeah.
Oxidative stress and inflammation plays a big role. And so the recruitment of immune cells and the production of their cytokines ultimately are what promote endometrial growth. And so something like vitamin C, vitamin E, potent dietary antioxidants, are thought to maybe play a role in that aspect, therefore lowering some of these clinical manifestations.
Okay.
So, and there are a handful of others. There's immune to kind of go along with oxidative stress and inflammation. There's immune dysfunction. There's the suppression of apoptosis. And so basically, anytime you hear that term, you just think of cell death, basically. So there's constant turnover of cells in the body.
Right.
And in this case, there has to be some sort of cell turnover when you think about menstruation in general. The turnover of cells in that area of the tissue. If that normal, cell killing or cell
death
turnover sort of occurs, if for some reason that goes awry and you're not regulating it in that line of the track, then you have this, proliferation here of endometrial growth. Also there's certainly a genetic component. And then there are also issues all the way down to stem cells.
Wow.
And so we think about, undifferentiated cells that are at the very base layer potentially leading to this.
Okay. So the punchline is we don't exactly know what's causing it. We have lots and lots of ideas, and we see lots of threads that we are trying to pull on and figure out what's going on, but we don't fully know. What are the typical, before we dive into the study, what is the typical treatment when somebody is dealing with this? Is it just painkillers? Is it hormone supplementation?
Yeah, all of the above. The diagnosis itself can be a bit convoluted, and not to skip over the question, but a lot of times women will opt for surgical procedures to treat this.
Oh, wow.
And so ultimately you won't know for sure until there's actual testing of the tissue, until like some of the tissue's actually removed. So that's an option.
Is that like you're talking about thinning out the tissue, or are we talking about like a hysterectomy?
Hysterectomies are often, kind of, I'm not sure if it's really last line, but if symptoms are so bad and you're, past the age of wanting to become pregnant, then, that it is a viable option at least. Now, there are other, laparoscopic procedures that can, I think, be less invasive or less sort of intense options. The surgical aspect of this is certainly not the full scope of this, but yeah, those are the general two options with respect to surgery. In general, what you'll see initially being used, NSAIDs, like you mentioned, will help manage some of the symptoms. As we mentioned as well, hormones play a role. So oral contraceptives, whether it's combined options, estrogen and progestin, or just the progestin component, those play a role. And something called gonadotropin releasing hormone. There's the GnRH agonists that are used for sort of this initial treatment of the pain, or for someone who's suspected to have this endometriosis related pain.
Yeah.
Those essentially at the level of the brain, change the hormonal cascade that occurs that ultimately affects the endometrium. So you are at the level of the hypothalamus, essentially down regulating the production of estrogen,
which then really leads to
sort of shuts down maybe the hyper proliferation of that cell type that can be occurring if it's, estrogen, certainly estrogen driven. Androgens also play a role. So there's a handful of different options here. There's something called add-back therapy. And so oftentimes women will start a GnRH agonist, which can sort of blunt the production of these hormones. And so quote unquote, adding back some hormone, maybe in the form of estrogen or a progesterone form, you can do that to not cause symptoms to occur again, but by reducing those hormones, there are potential side effects. So adding back some of the hormone can help, hopefully help mitigate side effect and prevent bone loss and those sorts of issues.
Okay. All right. So that's the normal treatment, but this study looked at vitamin C and vitamin E, and you kind of got into it. Why those two supplements in particular?
So in looking at oxidative stress, it's essentially just characterized by an imbalance between the reactive oxygen species and biological antioxidants. And so that mismatch, like we said, can potentially lend itself to the development of endometriosis. And so that's why there are certain diets that are recommended in individuals who might be experiencing this, those that are high in antioxidants, fruits and vegetables, particularly citrus fruits. They're higher in antioxidants, and so they maybe noticed or saw that this had an impact on symptoms. And so taking this one step further by treating people with dietary supplements, not just the amounts of these that are found in foods, by treating or starting something like a vitamin C tablet or powder, or starting something like vitamin E capsules or vitamin D in this case, they kind of took that one step further.
Sure.
So,
okay. So am I right in thinking that, and no is a correct answer potentially, that part of this is because inflammation in and of itself isn't bad. When there's tissue damage, then it becomes inflamed because the body is trying to heal that, and that's the excess, is it cytokines that are there, but that what happens is when that doesn't shut down, it just keeps going for whatever reason, like a closed loop. That's when it becomes a damaging inflammation.
Yes.
Okay. And these antioxidants help to kind of reset that process.
So they looked at, and that this will kind of help maybe answer the question or answer the direction that you're going. Not only did they see these reductions in symptoms that we'll talk a little more about, but they actually looked at these markers of oxidative stress. So they wanted to kind of look at the level of at the cellular level, at the level of the tissue, to see what was happening or in the plasma. And so one marker in particular, it's called plasma MDA.
Okay.
The concentration of this was decreased in patients who were suspected to have endometriosis. And after antioxidant treatment of some combination of E and C, they noticed a marked reduction in this.
Okay.
And it coincided again with the reduction in symptoms. So is this a 100% thing occurring? Right. Obviously not, because we just talked about 8 different potential causes and sources of this issue.
Sure.
But certainly in this case, it sounds like it's walks like a duck, talks like a duck.
Duck talking.
It's a duck.
Okay. So you mentioned the symptom reduction. What were the results? Because they looked at 12 different studies, you said?
So it ended up being 13 randomized controlled trials involving 589 patients.
Okay.
And 11 of them evaluated the effects that the supplements had on pain. So it's about 11.
Okay.
So they weren't the biggest studies, and this was one of the drawbacks.
Always.
You're talking like 30, 40, 50 people, 20 people per per paper.
Mm-hmm.
But nonetheless, a lot of the results pointed in a similar
Consistent
direction.
Yeah.
Yeah. And so the outcomes in this case, primary outcomes, they looked at the relationship between the vitamin supplementation and the endometrius related chronic pain specifically. Yep. And so in this case, they had vitamin E and vitamin C as the experimental groups. And then they also had vitamin E being used with oral contraceptives.
Okay.
Now, for the most part, the E and the C groups in this case, they did reduce the symptoms on a pain scale, looking at one of the validated pain scales. The one that didn't work very well in this case, or at least not statistically significant, was vitamin D.
Okay.
And so for the most part, that's the common theme here is C and E had the most kind of bang for their buck, whereas 50,000 units of D didn't seem to move the needle quite as much.
Which of course is not to say that D is not useful. It's just for this particular end goal that they were looking for.
Yeah.
It didn't do what they wanted it to do.
Yeah. There were some inconsistencies with respect to vitamin D.
Okay.
In this case. So in general, like I said, in general, you're going to see more of the profound benefit in these studies from C and E.
Okay.
And also another one of the limitations, they weren't quite able to control for different diets either. And then also you're talking about, an individual using vitamin E and one of the oral contraceptives, how much of the impact was one versus the other. I know they try to control for a lot of that, but it's at least worth mentioning. And, we'll not to get ahead of, some of the primary outcomes, but in general, it seems as though they're recommending this by itself, or these could be used by themselves at maybe similar dosing ranges to what's found in the papers, or it doesn't really seem like there were many issues using this in tandem with a, oral contraceptive, so to speak. So
of course not. Yeah, that makes sense.
So there are maybe a handful of use cases for these.
Fantastic.
The other outcome that they looked at were endometriosis related dysmenorrhea. So we mentioned the chronic pelvic pain. Now we're talking about dysmenorrhea as well. And so that's these sort of unpleasant issues with menstruation specifically. And same sort of deal. They used them in combination with oral contraceptives, also the C and E together, same situation. And then they also looked at the it's the dyspareunia, which is the painful intercourse.
Okay.
Pain around before, after, during sort of phenomenon. That was also one of the analyses that they conducted. And once again, the group with combined E and C seemed to have the highest rates of pain relief.
Oh, that's
versus
fantastic.
The control. So looking at secondary outcomes, this is where we talked about
plasma,
the peripheral oxidative stress markers. So yeah, there was the plasma MDA.
Okay.
Definitely less of the studies looked at this. So there was a total of 5. 4 of them looked at vitamin E and vitamin C together, and 1 of them looked at vitamin D use and measured those corresponding plasma levels. Seemed as though the effect was greater for vitamin E and vitamin C on that in particular, because when they removed the vitamin D study from that analysis, it seemed to show a greater reduction.
Oh, fantastic.
So in general, again, the common theme looking more at the impact of E and C. And so there were some other inflammatory markers that they looked at as well. C-reactive protein, there was some reduction. There was a significant increase in total antioxidant capacity.
Okay, so whether it was just through the subjective pain markers or the direct measurement of the what did you call it again? The plasma
MDA.
Plasma MDA. In either case, it looked like supplementation with C and E was effective in reducing pain and the secondary markers for endometrial pain. What were the dosages they were using? Since we're talking about, these are not numbers that people can get just by changing their diet. This is, what is the term? Joe would say it.
These are the therapeutic doses.
Therapeutic doses. What was the therapeutic dose that they were using for this?
So they did vary a decent bit. So that's some of the issues here. So
Sure.
The top end was 1,200 units of E.
Okay.
1,000 units of vitamin C, and then 50,000 units of vitamin D.
Okay.
Now, I'm not saying that that's what you need to take. We certainly don't generally recommend that much vitamin E. So in this case, this would definitely be something you want to, at least talk to your provider. In general, you need to.
Right.
But more or less commenting on what was used in here.
So our Perfect E has 400 IU,
which is
in
pretty
it.
standard.
So for these purposes, somebody would be looking at taking 2 to 3 to do what was done in this study, and then the vitamin C. I guess it depends on how many scoops you're doing, or if you're using the tablets or whatever. But that's easier to dose as well. But we're talking about more than just your typical multivitamin. Our Daily Essentials isn't going to cover it. This is specific therapeutic dose C and D. Okay. All right. That's exciting news. Anything else in there that we haven't covered that is worth going over?
There was plenty more in the meta-analysis. There was one of the studies that showed no statistically significant difference in the pregnancy rate between the supplement group and the placebo group.
Okay.
So there's just not enough here to talk about how,
it may or may not affect the
right. So reducing
ability.
the symptoms and maybe reducing some inflammatory or oxidative measures, like didn't look like there was a strong connection between that and pregnancy rates.
Okay.
So,
at the same time, in a study where they're also using hormonal birth control as one of the research groups, it's entirely possible that most of these people weren't actively trying to get pregnant. So it might not be a good indication of that.
potentially. Yeah, I don't know.
Yeah, I don't know. The point is, it seems to work. Vitamin C and vitamin E as supplementation for endometrial pain seems to work pretty well. So Dante, sum it up for me. This whole conversation in 30 seconds. What's the punchline?
Yeah, given the widespread nature of this, I mean, like we mentioned, roughly 10% of reproductive aged women experience this, which is a high sheer amount of people. And also given that there's no straightaway cure for endometriosis, and there are some more invasive measures that can be taken with surgery and such. Yeah. And for those looking to avoid that or try to kind of throw the kitchen sink at it, I can't imagine there's a whole lot of downside, to using some vitamin E, to use some vitamin C, in reasonable doses under the supervision of your providers, that there can't maybe be some added benefit to maybe some of the other things that you're already doing, whether it's NSAIDs or hormonal birth control or none of those. Like, this could certainly fit in maybe any one of the gaps.
A whole number of lifestyle designs. That is fantastic. Really exciting to see that. The lack of research into supplementation is always very frustrating. So whenever we get something like that, it makes me very happy to see. Anything else you got today? Anything else you want to talk about?
I think I'm tapped.
All right. Josiah, we got to find him.
We do.
That's it for us. All the products that we mentioned vitamin C, vitamin E, Daily Essentials. I don't think I think that's all we mentioned. But anyway, we have all of those supplements available at our website. That website is askjoedimatteo.com. askjoedimatteo.com. That's also where you can sign up for our newsletter, so you find out about sales, like a sale on Perfect E, which happens pretty regularly, or vitamin C, which happens pretty regularly. You can sign up for the email. You can check old episodes of this show, past episodes. They're not old. It's like a year old. Past episodes of this show, older episodes of the original show, Ask Joe DiMatteo, that started all of this, all on our website, askjoedimatteo.com. You can also ask us questions. We need those questions at askjoedimatteo.com. Just email them in. You can also leave a comment down below with any thoughts you might have or questions you might have. We love answering those. Do that. 5-star rating, thumbs up, all those things. We love it. Send the show to a friend. If you know someone who's dealing with endometrial pain, this is a great opportunity to try and help them out. That's it for us. Big thanks to Michael Depish, our editor, Joyce Gibb, our nurse practitioner who handles private consultations, Diane Silverman, who does products, Terry, who does scheduling, Cecilia, who does distribution. One of these days, I'm going to do it without stumbling. That's Dante DiMatteo. I'm Tyler Andrews, and that's it. Thanks, guys.